Seniors, beware. 9 popular medications that can trigger rapid dementia. As you delve into this crucial text, consider the stark and alarming reality. By the time you finish reading, approximately 20 seniors will have received the devastating news of a dementia diagnosis, a shocking frequency that translates to 1 person every 66 seconds. This unsettling prevalence naturally prompts a critical question that demands our immediate attention. What if the true root cause of this widespread cognitive decline isn't merely the inevitable process of getting older, but rather a perilous and insidious threat potentially lurking within your very own medicine cabinet? Despite repeated reassurances that these prescribed pills are generally considered safe, routine components of daily life, and even absolutely necessary for maintaining your overall health, groundbreaking new research is now unequivocally raising serious red flags that warrant deep concern. A staggering 99% of older adults remain entirely unaware that at least one medication they consume every single day could be actively shrinking critical memory centers in their brain by a significant margin of over 28% in less than 12 months. This profound and rapid impact demands immediate and serious contemplation. As Dr. Michael Kent, I have personally observed this tragic phenomenon unfold far too often within my professional practice. Countless individuals implicitly trust their prescribed medications completely, assuming that if a doctor has prescribed it, it must undoubtedly be harmless. Concurrently, the powerful pharmaceutical industry has reportedly been cognizant of these devastating cognitive effects for decades, yet continues to amass billions in profits from selling these very same drugs that may be directly accelerating cognitive decline in millions of seniors nationwide. A pivotal 2023 study published in Neurology and Aging Research further illuminated this crisis, specifically identifying one particular class of medications that dramatically increased dementia risk by an alarming 49% in seniors within just 2 years of consistent, regular use, an increase representing nearly half again the normal risk. This comprehensive overview will now proceed to unveil 9 of the most dangerous medications known to actively trigger rapid memory loss and ultimately dementia, progressively detailed from those commonly overlooked in their effects to those truly, profoundly mind-destroying. One particularly insidious medication on this list, despite being prescribed to millions for what appear to be completely innocuous conditions, possesses the undeniable capacity to shrink vital memory centers in your brain, often without you ever realizing that this detrimental damage is actively occurring beneath the surface. Your personal experiences are vitally important in this discussion, and reflecting on any sudden brain fog or unexplained forgetfulness experienced after starting new prescriptions is strongly encouraged, as we are actively reading every single comment to provide personalized insights and support. Remaining silent on this profoundly serious issue could literally protect and save your mind. Commencing our detailed review, we first address diphenhydramine, widely and familiarly known by its brand name, Benadryl, a medication that often sits in almost every senior's medicine cabinet right now, possessing the potential to insidiously scramble vital brain function even before the first subtle symptom is overtly felt. This universally familiar pink pill, trusted by millions of people across all age groups to help them fall asleep, relieve bothersome seasonal allergies, or ease common cold symptoms, is both inexpensive and readily available over the counter at virtually any drugstore, making it an ubiquitous presence in countless nightstands or bathroom cabinets. While you may genuinely believe you are simply taking it to achieve better nocturnal rest or to find relief from persistent allergies within the intricate and delicate confines of your brain, Benadryl is actively and directly disrupting your hippocampus, that specific and critically important region solely responsible for the complex processes of forming and storing new, vital memories. Diphenhydramine belongs unequivocally to a family of drugs scientifically categorized as anticholinergics, which operate by effectively blocking a crucial neurotransmitter called acetylcholine. This chemical messenger is absolutely indispensable, as it directly helps your brain create new memories and maintain essential alertness throughout the day. As your brain naturally ages, it becomes increasingly and fundamentally dependent on every single bit of acetylcholine it can possibly produce. And when medications like Benadryl interfere with that incredibly delicate and precise neurological process, the resultant consequences can be absolutely devastating for cognitive health. According to a comprehensive 2023 study published in the prestigious Journal of Geriatric Cognitive Health, seniors who used anticholinergic drugs on a regular and consistent basis had a striking 54% higher risk of developing dementia when compared to those who consciously avoided these medications entirely, a percentage that represents more than half again the normal risk, originating merely from taking what most people consider a genuinely harmless sleep aid. To proactively protect your precious memory, the first and foremost recommendation is to meticulously avoid anything containing diphenhydramine, especially if the product label prominently features terms like PM, nighttime, or allergy relief, as these products are often just Benadryl cunningly hidden under a different brand name. Furthermore, if you are currently utilizing diphenhydramine for allergy symptoms, it is important to know that there are much newer, highly effective, non-sedating options available, such as loratadine, which is commonly sold as Claritin. These newer generation antihistamines do not readily cross the blood-brain barrier and are thus dramatically safer for crucial long-term use in older adults. It is absolutely imperative never to stop any prescribed medication abruptly without qualified medical guidance and consultation, but it is equally vital never to automatically assume that an over-the-counter status inherently means a product is safe for your brain's delicate long-term health. Next, we examine proton pump inhibitors, PPIs, specifically Prilosec and Nexium, medications often marketed as gentle on the digestive system, yet systematically interfering with nutrients vital for brain health. These drugs, designed to reduce stomach acid for heartburn, GERD, and acid reflux, are commonly used by seniors for years, even decades, due to symptom recurrence upon cessation. What is rarely discussed, however, is how PPIs critically impede the absorption of vitamin B12, an indispensable nutrient for brain tissue, memory, focus, and mood stability. A groundbreaking 2016 JAMA neurology study analyzing over 73,000 individuals aged 75 and older revealed that regular PPI users faced a 44% increased risk of developing dementia. By aggressively suppressing stomach acid, PPIs hinder the body's natural ability to absorb not just B12, but also magnesium and calcium, minerals essential for neural transmission and brain cell signaling, leading to misfiring, confusion, and memory lapses that often mimic early Alzheimer's. Beyond nutrient depletion, PPIs have also been shown to increase levels of amyloid beta plaques in the brain, toxic proteins actively disrupting function and considered drivers of Alzheimer's progression. Fortunately, safer alternatives exist. If using a PPI daily, consult your doctor about slowly tapering off with H2 blockers like famotidine, Pepcid, which are significantly less likely to interfere with cognitive function. Chewing D-glycyrrhizinated licorice, DGL, a natural compound that soothes the stomach, can also offer symptom relief without cognitive harm. Next, we consider bladder control medications, specifically oxybutynin, ditropan, often prescribed for incontinence or overactive bladder, yet potentially harming short-term memory and emotional balance. While appearing as a practical solution, it blocks acetylcholine, the same critical brain chemical disrupted by diphenhydramine. Oxybutynin easily crosses the blood-brain barrier, directly affecting memory regions in the hippocampus, making it dangerous for seniors, especially with prolonged use. A 2019 British Medical Journal study found individuals over 65 taking strong anticholinergics like oxybutynin for over a year had a 49% higher dementia risk, nearly 1 in 2 users. Most seniors are never warned about these cognitive side effects, with harm often mistaken for normal aging, manifesting as mental fogginess, forgetfulness, or difficulty tracking conversations, rarely linked to the medication until significant damage occurs. If taking oxybutynin and noticing mental changes, these are real and alternatives exist. Newer medications like mirabegron, myrbetriq work through a different mechanism, showing significantly less impact on memory function as they do not block acetylcholine, making them safer for older adults needing bladder control. Proceeding, we address statins, among the most widely prescribed drugs globally for individuals over 60, intended to lower cholesterol and reduce heart attack and stroke risk, with simvastatin, Zocor, and atorvastatin, Lipitor as common examples. A significant issue arises because cholesterol is not solely a heart health concern. It is essential for the brain, nearly 60% fat, with cholesterol critical for forming and maintaining the myelin sheath, which enables efficient nerve signal transmission. Aggressively lowering cholesterol with powerful medications may inadvertently starve the brain of its necessary components. A 2023 study in Frontiers in Aging Neuroscience found seniors over 70 on statins for over 3 years had a 26% higher risk of mild cognitive impairment, with high-dose users experiencing more noticeable mental declines. Alarmingly, some patients report sudden onset memory loss, struggling to recall familiar names or routes. Crucially, not all statins affect the brain equally. Pravastatin and rosuvastatin, for instance, do not cross the blood-brain barrier as easily and are considered significantly less risky for cognitive side effects. If experiencing mental fog, increased forgetfulness, or confusion while on a statin, a serious conversation with your doctor about dose reduction or alternative cholesterol management is warranted, as early action is vital to protect your mind. Further, we examine benzodiazepines, encompassing widely prescribed drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax, commonly used for anxiety disorders and sleep problems. These medications enhance GABA, the brain's natural calming chemical, reducing overstimulation. While initially seeming like lifesavers, quieting thoughts and easing panic, over time they can become a perilous trap. A 2022 British Medical Journal study tracked over 8,000 seniors for 6 years, finding that those using benzodiazepines for over 3 months had a 51% increased risk of developing Alzheimer's disease, with risks higher for long-acting versions that accumulate in brain tissue. This leads to chemical sedation, progressively slowing neural activity, making the brain less flexible, less efficient, and prone to confusion, memory gaps, and emotional numbness. Seniors regularly taking benzodiazepines often describe a constant fog, feeling disconnected, or unlike themselves. The worst part is withdrawal, with severe anxiety, agitation, and debilitating insomnia, making the drug feel essential when it is the primary source of the problem. To correct this, never stop benzodiazepines suddenly if used for more than a few weeks, as this can be dangerous. Instead, work closely with a doctor to gradually taper the dose over weeks or months. Safer alternatives include buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, which can restore calm without progressive memory loss or cognitive decline. Next in our discussion is amitriptyline, sold as Elavil, an antidepressant surprisingly common for chronic pain, insomnia, and migraine prevention. While appearing versatile, it is one of the most potent anticholinergic medications in widespread circulation, powerfully blocking acetylcholine, the chemical messenger vital for neuronal communication, memory formation, and mental sharpness. Its strong blockade means cognitive effects are essentially expected with long-term use. A massive 2015 JAMA internal medicine study examining over 3,400 adults aged 65 and older found those taking higher cumulative doses of anticholinergics like amitriptyline over a decade had a 54% greater chance of developing dementia, more than half again the normal risk. Terrifyingly, most patients were never told this drug could actively harm their memory, often prescribed for sleep or nerve pain, then slowly noticing short-term memory loss, word-finding difficulties, and foggy concentration. Even low-dose amitriptyline taken nightly over several years can cause a slow, invisible erosion of brain power, a gradual decline mimicking normal aging but actually drug-induced cognitive impairment. If you or a loved one is taking amitriptyline, speak with your physician immediately about safer alternatives. For nerve pain, duloxetine or gabapentin may offer equivalent relief without the severe anticholinergic burden. For sleep, melatonin or very low-dose doxepin with a milder anticholinergic profile can be used with less risk. For mood support, newer antidepressants like sertraline or escitalopram are generally dramatically safer for long-term brain health. Moving to paroxetine, marketed as Paxil, one of the most prescribed SSRIs for depression and anxiety. While appearing modern and gentler, a critical detail often overlooked is that paroxetine is the only SSRI with significant anticholinergic properties, meaning it interferes with acetylcholine in your brain, fundamentally differentiating it from SSRI siblings like sertraline or escitalopram. A large 2021 comprehensive review in Frontiers in Psychiatry showed paroxetine users among elderly patients experienced measurable declines in short-term memory, verbal recall, and attention span within just 12 months, and were 30% more likely to show early cognitive impairment signs compared to those on other common antidepressants. The irony is that paroxetine, prescribed to stabilize mood, systematically undermines mental clarity and emotional regulation over time, defeating its purpose. The fix is essential. Avoid paroxetine entirely in seniors. The American Geriatric Society has officially placed paroxetine on its Beers criteria list due to safety concerns for older adults. If currently taking it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and lack the serious cognitive risks. Additionally, B vitamin supplementation, especially B12 and B6, can naturally support mood stability and potentially diminish your overall reliance on antidepressant medications. Next, we delve into antipsychotics, a category particularly alarming as many seniors are unaware they are consuming such potent medication. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, originally for severe psychiatric conditions like schizophrenia and bipolar disorder, are frequently prescribed off-label to elderly patients for common sleep problems, mild agitation, or behavioral changes associated with dementia itself. This means powerful pharmaceuticals designed for profound psychiatric illnesses are routinely administered in nursing homes and hospitals to seniors who may simply be confused, restless, or perceived as challenging to manage by staff. The repercussions of this widespread practice are nothing short of devastating. A comprehensive 2022 Lancet Healthy Longevity study tracked over 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were a staggering 71% more likely to experience worsening cognitive decline within a mere 12 months, even without prior dementia history. Even more grievously, these dangerous drugs dramatically elevate the risk of stroke, sudden cardiac death, and severe sedation, which can directly precipitate falls, necessitate emergency hospitalization, or lead to permanent institutionalization. The underlying mechanism responsible for this damage is brutal and direct. These medications aggressively suppress dopamine, a neurotransmitter intimately connected not only to mood and motivation, but also absolutely critical for executive function and precise memory processing within your brain. When dopamine levels precipitously crash, your brain becomes sluggish, slow, and unresponsive to stimulation. This accounts for why seniors taking antipsychotics often appear dull, emotionally flat, or completely zombified. Their distinct personalities seem to vanish, and family members grieve for an individual who is still physically present but mentally and emotionally absent. Rectifying this tragic situation begins with posing challenging, direct inquiries. If you or a beloved family member are currently consuming one of these powerful medications, it is imperative to ask the prescribing doctor for the explicit reason it was prescribed and whether it is genuinely medically necessary or merely being employed for staff convenience. In the vast majority of cases, behavioral symptoms can be effectively managed through non-pharmacological interventions, such as structured daily routines, mitigating environmental noise, addressing pain, and substantially improving sleep hygiene. When medications are deemed essential, employing the lowest possible doses for the shortest feasible durations can significantly reduce potential harm. However, all too frequently, these drugs are utilized out of pure convenience for staff, rather than representing a genuine medical necessity for the patient. The profound tragedy lies in the fact that many families are never truly informed about the actual effects these drugs impose on the brain. They simply observe their loved one rapidly declining without ever comprehending that the root cause is chemical, not a natural part of aging. Finally, crowning this list as the most critical and pervasive danger is anticholinergic polypharmacy, a hidden threat largely undiscussed, yet genuinely one of the biggest contributors to drug-induced dementia in the elderly. The most perilous medication situation for rapid dementia isn't one particular pill. It's the silent, cumulative effect of concurrently taking multiple medications with anticholinergic properties, a dangerously synergistic situation medical professionals term anticholinergic polypharmacy. Consider a common scenario. A senior takes diphenhydramine nightly for sleep, oxybutynin daily for bladder control, and amitriptyline for chronic pain. Each alone might cause mild memory problems, but combined, their effects compound exponentially, skyrocketing the cumulative anticholinergic burden on the brain. This isn't theoretical. A 2022 analysis in Age and Aging tracked over 280,000 older adults and found those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years, more than double the normal risk. The worst part is most seniors were unaware they were taking anticholinergic medications. When acetylcholine, the brain's vital neurotransmitter, is blocked from multiple angles, your brain doesn't just slow down, it actively decays and deteriorates. Neurons physically wither from chronic underuse, synapses shrink, and your brain enters a hypoactive state nearly identical to Alzheimer's on cognitive testing. Correcting this perilous situation demands a thorough, comprehensive medication review. Request your doctor or pharmacist to meticulously evaluate your entire list of prescription medications, over-the-counter drugs, and even supplements for their potential anticholinergic load. Online tools can calculate your cumulative anticholinergic burden score. Once identified, you can systematically deprescribe, slowly and safely tapering off unnecessary medications, transitioning to safer alternatives whenever feasible, and thereby naturally rebalancing your brain chemistry. This truly represents the most empowering revelation. Drug-induced dementia is remarkably often reversible when identified sufficiently early. When the detrimental medication burden is successfully alleviated and removed, many seniors experience a dramatic resurgence in mental clarity, physical energy, and memory function within weeks or months. Your brain possesses an astonishing capacity for resilience and healing, but only if afforded a genuine opportunity by diligently removing the very elements that are actively harming it. Polypharmacy, particularly involving anticholinergic agents, is not merely dangerous and harmful, it is profoundly preventable. This undeniable fact elevates it to the undisputed position of the #1 hidden medical threat to the minds of our entire aging population. In conclusion, I genuinely invite you to share your experiences and forthright opinions in the comment section below, as your story could potentially provide invaluable guidance to another senior seeking to avoid this perilous situation and protect their cognitive health. Your engagement helps foster a community of awareness and support. Thank you for engaging with this crucial information and taking the time to prioritize your mental well-being. And always remember, I am Dr. Michael Kent, dedicated to assisting you in remaining sharp, healthy, and robust for all the fulfilling years that lie ahead.